justice for all. First call to the public, limited to 3 minutes per speaker. Is there anybody in the public that would like to speak? Nope, nobody there. Okay. So moving on to our agenda items, I need a motion to approve the refilling of an animal control officer.
So moved.
Support.
Budgeted position, this person resigned earlier this month, and we have someone who has recently applied, a couple of them that are good candidates. I did allow the sheriff to post this ahead of time because the person left immediately, and once it's approved on Wednesday, I think they'll have someone to fill the position.
Any further discussion, questions? All those in favor, please approve by saying aye.
Aye.
All those opposed? Motion passes. I need a motion to authorize MERS to allow Sheriff Ryan Hall to purchase 12 months of service credit as requested.
So moved.
Support, should say sheriff's deputy.
Sheriff, yes, I do.
Yeah, I was
Sheriff,
like,
I was like, wait, what?
I gave you.
I did read it as a different county sheriff. I thought that was on today, but no, it's
I gave
deputy. Gotcha.
He'd like to purchase 12 months of service time. When they do this, they pay both the employee and the employer share plus whatever the actuaries calculate based on years of service and expectancy to retirement. And then he has to pay that amount if he so wishes, and it's all on him. And it essentially goes into his account. There's no cost to us, but it is required that the Board of Commissioners approve it because you are the policy holders.
I mean, I'm fine with it. I hate to lose a good deputy after all these years.
He's not going anywhere yet.
So if we say no, he has to stay, or is that?
He's not retiring at this moment.
Oh, okay.
He's preparing for it, but it's not imminent at the moment. It's not like he's gonna get this done.
How many years do you have for a sheriff?
I think they have to have 25
Oh,
for the sheriff's department.
So he's darn close.
He's close, but he's not there yet.
Okay.
So why is he asking for just in preparation of retirement? Just
You can purchase time, so any employee who's in the MERS program can purchase additional years of service credit towards their retirement.
okay.
It's like adding additional money to your 401.
Ah.
But because it's a defined benefit program, and you guys hold the policy to it, you have to approve it.
Okay.
That's the difference.
Who did I tell you that it was 46,000? Was it?
Any further discussion? Curious.
I
Any
don't.
further discussion?
Oh, we're just
Sure.
wondering how much like it costs.
$40,000.
That's like 40,000. Okay.
I believe that is the last number I saw.
Any further discussion on that? Okay. All those in favor?
Aye.
All those opposed? Motion passes. Need a motion to approve the contract between Father Flanagan's Boys Home, Boys Town, and Shiawassee County for Shiawassee County for youth treatment.
So moved.
Support.
So this is a program that we use occasionally to send youth to that are struggling, delinquent youth. However, we don't use it very often because it's so far away, and we don't use it very often because it's a little expensive. But they will not even be able to use them as an option without entering into a contract with them. So we have to have essentially a retainer with them or a contract agreement with them in order to be able to have them get it as an option.
It actually didn't seem like it, to me, it was that expensive to,
$295 a day.
I mean, when I look at what it cost, community mental health for some of the, like what I would consider
Yes.
inpatient.
$1,000 a day.
Yeah. I mean, there's some kids that for $300 a day, I'd send them there.
Sometimes my own.
Yeah. That's kind of what I was thinking. I was like, are they too old?
Any further discussion on that? Okay. All those in favor, please signify by saying aye.
Aye.
All those opposed? Thank you. I need a motion to approve the replacement of the deputy probate register at a grade 5 and part-time guardian ad litem at a grade 3 as presented. So moved.
Support.
So I have paired these two together because of the way that they're moving. Most elected officials and some appointed officials have a confidential employee that is assigned to them. In this particular case, the Deputy Probate Register Grade 5 is Judge Dignan's confidential employee. So for example,
Caroline?
Caroline's deputy, sorry, Caroline's deputy.
Was it Carol? No, Carol. No.
Caroline's chief deputy is her confidential employee.
Okay.
Julie's chief deputy, the undersheriff, Morgan to me, those are confidential employees, and so they get to pick them themselves. And so while you are funding him, you're legally required that he gets a confidential employee that is funded, and he gets to pick it. It doesn't have to be posted, it's not part of the union. But someone who is already in a position there that we hired previously as a guardian ad litem would like to move into that position, and Judge Dignan has given that the green light, and then we will repost that guardian ad litem grade 3 position. So someone that's already working for the court is going to move into that confidential position, which he can do with or without your permission, and then you are filling the grade 3 position.
And confidential, just for terminology, like we have in Lansing, unclassified.
Correct.
That's basically, okay.
That's exactly the same thing.
Okay.
I've never heard that term.
I've never heard confidential, I've just heard unclassified,
It's a
but
term
it
of
means the
art.
same, yeah, okay.
Okay.
So any further discussion on that? Okay. All those that approve the motion, please signify by saying aye.
Aye.
All those opposed, motion passes. Lastly, I need a motion to approve the replacement of the family court financial advisor at a grade 5 and register at a grade 4 as presented.
So moved.
Or it's similar but yet different situation. The grade 5 financial advisor is retiring. Someone who is a grade 4 who would like to seek promotion is going to move into that grade 5 position, which opens up a grade 4 posting position. So we're asking to fill both of those. Technically, you do have to fill both of them. They can't just switch and move, because as soon as someone leaves a position, it becomes unfunded. So you're reallocating the funding for both.
Any discussion? No, okay. All those approve the motion, please signify by saying aye.
Aye.
All those opposed, motion passes. Move to the last call to the public. Anyone have any comment? Okay, then the Public Safety and Courts meeting is adjourned.
Go ahead. Why is it payment funded? If we fund a position on the first. Oh. Okay. Oh, thank you, sorry.
Sit like no.
I was waiting for it.
Oh, yeah. Sure. No, but he wasn't standing there.
The hammer doesn't.
Although it should.
All right, we ready?
Yeah.
Let's call this meeting to order. If we could stand for the pledge, please. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. First call to the public. No public. So that brings us to our one and only agenda item. I would look for a motion to approve the contract between Shiawassee County for the Health Department and RESD for technology services for the period of July 1st, 2026 to June 30th, 2028, and authorize the board chair to sign all necessary documents.
Support.
Moved and supported.
Very briefly, it's the same contract that you approved for the rest of the county on Monday, except this one is specifically to the health department because they have their own level of funding and some of their own services. The contract has increased 3% from 2 years ago, which, and then will be locked in for those next 2 years, which is just a modest increase.
Very nice. All right, anything to add?
Just outstanding service from the RSD and obviously Jason. who's assigned to us.
Heck yeah.
Awesome.
All right. All those in favor of moving that forward signify by saying aye.
Aye.
All those opposed, nay. So we will see that tomorrow. The only other thing, I don't know, Larry, if you'll be here tomorrow, but could you give us just a short update on New Directions?
I haven't checked with our nurse since last month, but we're continuing the program since the funding has been renewed, by you guys last month. She continues to spend, 2 days every other week out there
Okay.
between 10 and 2, which is their high point for, their consumers that are using the resources. And there's been an uptick in the people that are coming there with the decline of the,
Salvation Army.
Salvation Army.
Yep.
So, we're very happy to continue that, and once again, that comes from the opioid funding.
Okay, good. Yeah, that, I think that was kind of the concern that I heard with, you know, the Salvation Army. Are they closed, do we know, or winding down, or whatever it is that was.
They're completely, right,
Yeah.
yeah, they shut down. The guy who came up, they brought it, I think it's already left.
Okay. Alright,
Increases the need.
well, keep up the good work.
We will.
Alright, anything else for Health and Human Services? Okay, we are adjourned.
That was all.